We're going to be halfway through after this chapter. This week you're going to be learning about the joys of puberty. Basically, many body changes, both physical and sexual maturation. There are many gender differences. For example, girls' life just isn't fair because our body fat increases very rapidly during this time. And for you young men, your muscles get stronger. And the brain growth during adolescence, basically beginning to be nearly adult size. They say that our brain reaches full maturity at age 20. Just look at all the decisions that teens make before they're 20. Now that's a scary thought, isn't it? Especially when it comes to sexual maturation, because many peer pressures encourage teens to become sexually active before they really realize the true risks involved with pregnancy and disease. So as we think about sexual maturation, you're going to be learning about the primary sexual characteristics. These are when the organs develop so that they're able to reproduce. And then the secondary sexual characteristics are those changes that we go through in puberty. So you'll be learning about those. 2 words you're going to be learning about that go along with this are menarche. That's when a female starts her period, and she may have a period 1 month and then may not have one for a few months. So it takes it a while for regularity to begin. Typically around the age of 13 is when this happens, but it is not unusual for young girls to start their periods as early as age 8. They say we're healthier. I think we are bigger people today, and with more body fat comes an earlier onset of puberty. And then the term for males is spermarchy. That usually happens around age 13 as well, when the first spontaneous ejaculation of sperm-like fluid appears. There's many psychological aspects of puberty. Body image. Generally, girls worry more about that than boys. They're more likely to be dissatisfied with their appearance. Boys can be unhappy too if they don't have the muscle strength that they expect. When it comes to responses to both menarche and spermarchy, there's some differences there as well. Girls will usually tell their mothers and then their friends, but boys rarely tell neither that that's happened. It's more of a private thing for boys. Moodiness, yes, teens are moody, and many times they think that the hormones cause that. Basically, it's not so much the hormones, it's more changes in activity and social settings. The peer situation can cause the moodiness, the things that occur with that during the puberty years. As far as rates of maturation, early maturing boys will often feel better about themselves because they're more muscular, they're getting facial hair, and so that makes them feel more like the man they're becoming, and they get excited about this in contrast to comparing themselves to their peers. Girls, on the other hand, feel less well about themselves if they go through puberty earlier, mainly because they start getting percent body fat. More so than other girls who are not starting their period as early as some. Problem with that for girls is that they appear older, and they may be pressured into sexual activity because their peers, boys, think they're older than they are. Also, boys, they run the risk of early sexual activity as well if they mature early. So that can be a negative for both boys and girls. When it comes to health of adolescents, nutrition, puberty brings special nutritional needs. The girls need more iron because of the menstrual cycle. Calcium, bones are growing during this time and they need more calcium. In fact, the best time to get calcium is during the childhood early adolescence years, that's when you want your bones to be the strongest. And often young kids, young teens don't drink the milk that they should. They're drinking more pop maybe, so they need to drink milk so they get that calcium naturally. Obesity is a concern. Both overweight children and adolescents become less popular, they have lower self-esteem, and they're at risk for more medical problems, not only then but throughout their adult years. Heredity plays some role, but the influence of the environment is the greatest impact on obesity. TV advertising, we see things that we want to buy, foods, junk foods, and basically they say there's no such thing as a junk food, but foods that are less healthy for us, foods that are higher in fat, higher in sugar. Parents can even inadvertently encourage obesity because they emphasize external eating signals. In other words, it's time to eat rather than relying on the body's internal signal to eat. We basically have an internal signal that tells us when we're hungry, and we should follow that rather than, oh, it's just time to eat. We need to eat when we are truly hungry. Plus, sometimes teens don't get the sleep that they need, and so too little sleep can lead to weight gain. If we aren't sleeping, we may be eating. And we also burn a lot of calories when we're sleeping, so we need to get good sleep, and that will help our weight as well. There's effective programs for treating obesity to help us change our eating habits, encourage activity, and discourage sedentary behavior. So along with health and eating, we have the eating disorders. They will be covered in this chapter. Anorexia, basically that's an intense fear of becoming overweight, a very grossly distorted body image. Girls may not be overweight, but they see themselves as being overweight. And so they literally starve themselves, and then that throws off their metabolism so that it even makes it harder for them to keep their weight in check. The other eating disorder that's a big problem is bulimia. And this is a cycle of binging and then purging. People that are bulimic can eat as many as 20,000 calories in one setting. And then they want to get rid of them. And they think, oh, they're eating this many, then they go to throw them up or exercise intensely. But they still are going to absorb a lot of the calories. So a bulimic is often not thin. It's harder to recognize them as having an eating disorder because they are not overly thin, because the body has absorbed those calories. Heredity can affect eating disorders as well as psychological factors. Adverse life experiences, just fear of extreme weight gain, so body image, internalizing that the body has to be thin for young girls. And girls are not the only ones that have issues with eating disorders. About 10% of those that have an eating disorder are boys. We're seeing more of those in the California area. More boys there are concerned about their body image. And so we're seeing a movement toward more boys than we have had in the past. There are programs to help teens who have an eating disorder. It's a restoration of your body weight, learning to eat healthfully. And then there's also a psychological aspect. And many times it isn't just the person with the eating disorder that needs the treatment. It is a whole family issue to help them figure it out and get back on track. Physical fitness is very important. That will help reduce the risk of many health problems. Many teens are engaged in organized sports, so that's great to keep teens physically active, because if they aren't involved in a sport, many times they do not get enough exercise. Organized sports can enhance self-esteem and provide an opportunity to also develop social skills. On the flip side, sports can lead to injuries, so we have to be careful with that. Coaches need to make sure athletes are safe, they are well conditioned, so that they put themselves at less risk for these injuries. And then, of course, the use of performance-enhancing drugs is a negative, something that we see in cycles. Other threats to well-being, adolescents, about 1 in 2,000 dies, usually from accidents. The most common cause would be motor vehicle for both boys and girls, and then firearms for boys. And then the next most common cause of death for both boys and girls is suicide. And that just goes along with so many of the social pressures that teens face today. Many of these deaths are preventable. Teaching children not to drive too fast, not to text while driving, definitely not drinking while driving, and then making sure they wear their seatbelts. They feel like they are invincible, that, oh, that won't happen to them, and so they don't think twice about texting or drinking and driving, and they think, oh, well, I don't need to wear my seatbelt. So as parents, we really need to encourage this with our children. As far as firearms, many of those that die due to those, they just have way too easy of access to firearms, usually in the home. So we need to make sure there is not the access, and that children that are raised around guns in the home learn how to operate them safely. Information process during adolescence. The adolescent's working memory is about the same as an adult's, so that's the brain development, that's the size of an adult. Myelination during adolescence increases, so they have more nerve impulses that travel rapidly. They have greater ability to problem solve and reason. You're also going to be learning about Kohlberg's theory of moral development. This is very enlightening, a very good study, and so you'll have that to look forward to at the end of this chapter. So enjoy learning about the physical and cognitive development of adolescence.